without further ado, I'm actually going to transition us into the next section of our agenda, which is a panel, which is going to feature some wonderful folks that MPHA has the pleasure of working with. And one of the most exciting things about this panel is these folks work across different issue areas. And so we're really excited to hear from them. So what I'm going to do in a little bit is I'm going to ask all of these partners to join us in this space. And then we're going to begin our panel session. But before I do that, I just want to sort of frame this panel up a little bit more. So what we're going to do is, as mentioned, we're going to have these panelists join. We are going to, I'm going to introduce them and we're going to hear a little bit more from them about what it is that they do. And then I have some key questions for them about their work. As we enter a new state legislative session, there are many things that have been accomplished. And so we want to hear about that, just as there are things that have been left not quite done. And then we also have this new federal landscape that has the real potential to impact the work that people have either already achieved or are looking towards achieving within their organizations. And so we definitely want to hear more about that. As I mentioned before, these folks work across sectors. And so this is really important to us as a public health organization, because we know that all of these things that our partners work on, whether it be finance and budget, whether it be food, climate and environment, or local public health infrastructure, all of these things really impact the health of communities. And so we're really interested in what it is that they have to share. And I will just share as well that for this panel, we will not have time for Q&A from the audience, but I encourage you all, if there are really burning questions that you have for these folks, please feel free to put it in the Q&A. And if there's time, what we will likely do is follow up after the conference with some written responses to some of these questions. With that being said, I'm actually going to invite our panelists to join me on the screen. Alrighty, beautiful. And so I'm just going to give a brief introduction of each before we jump into our first question. So we have Liz Ogilvie with us, who is the director of the Springfield Food Policy Council, as well as Gardening the Community. And Liz is also a Mass Food System Collaborative Advisory Board member. We're also grateful at MPHA to have her be a member of our Policy Council, which, as I mentioned before, has the role of helping to shape the organization's policy direction. And so please join me in welcoming Liz. We also have with us Paula Garcia, who is the Senior Energy Analyst and Energy Justice Lead with the Union of Concerned Scientists. Paula is also a fellow allied member with MPHA on the community-based statewide Environmental Justice Coalition, the Environmental Justice Table, which advocates for community-based policy that addresses the needs of environmental justice communities. So please join me in welcoming Paula. We also have Viviana Abreu-Hernández, who is the president of the Massachusetts Budget and Policy Center, which is a longtime partner of MPHA on work to advance things like regional transit and progressive revenue. Please join me in welcoming Viviana. And then last but certainly not least, we have Shin-Yi Lao, who is the Commissioner of Health and Human Services in the city of Newton, and is also a strong partner with MPHA on the successful Safe 2.0 campaign. Shin-Yi is also a member of the Coalition for Local Public Health, which MPHA helps to convene. And so let's welcome Shin-Yi. Alrighty, so the first question that I have for you all is, can you briefly just let us know for the audience here, because some folks may know of you all, may know of your work, may know of your organizations, others may not be familiar. Can you let us know what your organization does and what the core of your work has been over the past few years? If you can share that briefly. And then what I'm really interested in knowing from you all is, coming out of the 2023-2024 legislative session, what are some of the victories that you've seen in your work? And maybe what's yet to be done that you were disappointed by? And if we could start with Paula, that would be great.
Absolutely. Thank you so much, Alexis. So, Paula Garcia, I'm with the Union of Concerned Scientists, which is a nonprofit that puts rigorous, independent science to work to solve our planet's most pressing problems. UCS was founded more than 50 years ago by a group of scientists from MIT, scientists and students from MIT that wanted to make sure that sound science was informing policy making. I am in the climate and energy program. And in terms of our work in Massachusetts, one of our priorities has been centered around advancing a fast and just transition to clean energy to address our climate crisis and to improve the health of our communities. In this context, the last legislative session, that was 2024, um, included different bills focused on streamlining the siting of clean energy infrastructure. So most of the conversation was being focused on the ability to build fast as a key component to a clean energy transition, but doing so with appropriate attention to the needs of communities, particularly those that have been most heavily burdened by our energy infrastructure and pollution, was just as crucial. And what we did is that to inform this discussion around siting reform, we conducted an analysis that found that to date, infrastructure siting has put a disproportionate burden on environmental justice communities where people of color, low-income people, and limited English proficient speakers live across the country, across the state, I'm sorry, and the country actually. While close to 50% of Massachusetts neighborhoods classify as an environmental justice neighborhood, more than 80% of existing polluting electricity facilities with their associated health risks are located in or within 1 mile of an environmental justice neighborhood. And as we know, fossil fuel power plants, in addition to producing heat trapping emissions, also emit air pollutants like sulfur dioxide, nitrogen oxides, and particulate matter, which are harmful, particularly for the communities living near the facilities. Based on the findings of our analysis and guided by priorities from the Massachusetts Environmental Justice Table that Alexis mentioned briefly before, we provided three key recommendations. The first one, including a cumulative impact analysis, this to ensure that new energy infrastructure won't exacerbate the overconcentration of burdens in environmental justice neighborhoods. The second one, expanding the state's energy facility siting board to include representation from environmental justice and from indigenous sovereignty perspectives. And the third one, making sure that public health and climate impacts are priorities for decision making at the energy facility siting board. And right now, I'm very happy to report that all of our recommendations made it to the new climate and energy law that was signed by Governor Healy just a few weeks ago. And of course, this victory was only possible thanks to the tireless advocacy of many local groups and also to the thousands of individuals like you that contact your legislators to make sure that this victory was possible. Thank you.
Awesome. Thanks so much for sharing that, Paula. It really is exciting and something we weren't sure was going to happen and, happen, after the formal session ended in July 31st, which was really exciting. And so thanks for all of the work that you did on that and for all of our partners at the Mass Environmental Justice Table. I will go, Shin-Yi, next to you with this question.
Hi, everyone, and thank you, Alexis, for having me. I'm wearing a couple of different hats in this space. In one hat I wear is as the commissioner of the Newton Health and Human Services Department. We're one of hundreds, literally hundreds of health departments across local health departments across the state. And in that space, I lead a team that provides a range of statutory and foundational public health services to our residents. The other hat that Alexis mentioned was as a member of the Coalition for Local Public Health. That's an organization of organizations. It's a coalition of 7 different professional public health organizations like the Massachusetts Large Cities Health Coalition, which is how I'm connected. MPHA is a member, Massachusetts Health Associations, among others. I think in terms of this legislative session, what we're really excited about, Commissioner Goldstein already spoke about in the previous session. It was a long journey, but SAFE 2.0 is finally law. And we're so excited at the local public health level. This is going to revolutionize the way we're able to provide local public health services to our residents and to think about it through an equity lens around, as Commissioner Goldstein already mentioned, being able to commit to achieving positive health outcomes regardless of your race, income, or zip code. I won't go into detail about it since Commissioner Goldstein already spoke about it very eloquently, but I will say I think what we're gearing up for next, all of us in local public health are looking at what does implementation look like, right? So that's always the next step. You have this great law, and what does that look like on the ground? So that's what I'm looking forward to.
Thanks, Shin-Yi. Why don't we get Viviana to go next in answering our first question?
Hi to everybody, and it's a pleasure being with all of these amazing women in this panel. So Mass Budget and Policy Center, what we do is rigorous analysis and research about the state budget. We strongly believe that the state budget in Massachusetts and also at the national level is a values document. So we look at the state budget and additional policies from equity perspectives. We look at how the state has been investing its revenues and resources, and we make sure that in the process of allocating resources, the state is thinking about the most vulnerable populations and uplifting people from historical poverty and structures that have perpetuated lack of access to education and additional resources. So strong research, strong advocacy, strong policy analysis. So one thing that we were very happy about is that the fair share was used as exactly the voters wanted it to be used in the investment in education, in transportation. And one thing that we would have liked to see and we couldn't see was a revenue line that will go directly to build affordable housing. So the Affordable Homes Act allocated, $5 billion, but in bonds. So what it has allowed is the state to get into debt to be able to build affordable housing with investment from external sources. So we would have loved to see a specific revenue line that the state was allocating. And together with other coalitions, we will continue to work on that.
Thanks, Viviana. And to round us out, Liz.
Thanks, Alexis. I want to echo Viviana and say it's pretty tremendous to be on this panel. I noted this during our session. We all knew Alexis, I think, but we didn't know each other. And as the elder of the group, to be on screen with all these women of color representing, such a broad section of humanity, I want to say, just put women of color in charge and it'll all get fixed. I don't enter the room by myself. None of us do. So I'm gonna just in the chat, I've noted 2 women who I met, Dolores Huerta. I never met Fannie Lou Hamer, but I want us to consider that the work we're doing, we are bringing people in the room with us. So I'm bringing in Cynthia Mitchell, who was one of the co-founders of the Springfield Food Policy Council, where I work. And the Food Policy Council started, like many others do, we started with a grant from the Robert Wood Johnson Foundation before I was engaged by a number of large organizations that recognized we needed a body to look at municipal policy through a racial and equitable justice lens. And so our early work was very much about coming up with local municipal policy. And then as I moved from being a resident member of the body to more of a leadership role, in part because funding went away and candidly, the white folks who were part of organizations that helped found us, they went away when the funding went away, which seemed to stop us for a minute. That happened right before the pandemic, and then the pandemic threw everything apart. We didn't lose our focus on state policy, but it illuminated for me how many conversations we weren't a part of, and the we being the people who were most impacted by public health policy. So one of the things that I think has been unique to our shift in the last probably 8 years, 6 to 8 years, has been all of our work is done through a public health lens. So when we are coming up with policies, we're looking at what are the public health impacts on the community. It's not just about mitigating hunger, which is really important, but we need policies that are going to gnaw away at the edges of food-related preventable diseases, which people in Springfield and broader Hampden County suffer from more than anyone else in the state, according to Robert Wood Johnson Foundation. And then I've always had an awareness, because I've lived in many other states, that Massachusetts is not an island unto ourselves. So someone noted the rising and most expensive housing cost, but we're also one of the richest states. And it's about helping us to understand our priorities, inclusive of all public health. But for me, it's food, because it's an ancestral lineage that I didn't realize I had. I worked in housing, I worked in economic development, thinking all these things would inform change, and they really haven't. And then policy leapt up at me. And for me, food policy and justice started in the agricultural system. So if we can begin to crack at these nuts in all of our lanes, most recently in Massachusetts, we've been very focused on HIP. Many people don't realize that HIP was initially launched in Hampden County back in 2011. We've been chewing on it for a long time, and I say it's one of my 3 children. I have 1 child who lives in my house. I have HIP and I have gardening the community, and try to nurture them all. And in the context of what has to be done that I was disappointed by, just globally, I'm disappointed by MPHA is one of the few places where I don't feel like I'm in competition with like my sisters on this screen, that we understand the intersectionality. And I think we need to help our legislature understand the intersectionality. But frankly, HIP is medicine. We know that food is medicine, and making fresh produce available to every marginalized family who receives HIP is the easiest and best way to get food as medicine in folks' hands. We need an additional at least $10 million to eradicate these cuts that have been put in place recently. Families went from having an additional $40 to $80 a month to having only $20. And we need to rectify that, and the legislature could do it. And we need to make HIP permanent, so it's not an ongoing conversation. Thanks, Alexis.
Thanks so much, Liz. Going off of what you all just shared, I'm very curious to know, with the incoming federal administration, that's been something that's been a running theme across our panels and our speakers today. But curious to know from your perspectives in the work that you do, the spaces that you're in, with the incoming federal administration, how do you see the landscape of your work shifting? Are there any challenges that you anticipate? And maybe we can start with Viviana this time.
Thank you, Alexis. I just got back from a week of conference, and in which I met with my peer organizations across the country, and with the Center for Budget and Policy. It's not looking good. So let me just put it in perspective. Massachusetts budget is a little over $50 billion, and it just depends on the year. For 2025, the Massachusetts is assuming a $14.3 billion coming from the federal government. That is about 28%. It just depends on the revenue of the state in Massachusetts. So let's just put it conservative, that's 25% of Massachusetts budget comes from the federal government. Of the $14.3 billion, $12.3 billion, or 86% of that federal government goes into Medicaid. And the other 2.3 goes into programs that are affiliated or related to the temporary assistance for needy families, or TANF. So I think that we should not be surprised that there are going to be significant cuts in safety net programs for the most vulnerable populations across the country. In the conversations that we were having, it's an issue of cuts in SNAP, cuts in WIC, cuts, forget about Social Security, that's on the shopping block too. We're talking about Medicaid, health insurance, health. And the question that we need to ask ourselves in Massachusetts is, are we going to preemptively comply, or are we going to resist? And how do we do that? So what other states are trying to figure out, in particularly organizations like Mass Budget that pushes for an equity lenses budget, in which we make sure that the most vulnerable populations are taken care of because we built an economy on their backs. It is when those cuts come, is Massachusetts going to pick up the ticket? And if so, what kind of revenue lines or sources or that we are going to use in existence, or that we're going to have to create? But it is going to happen. So I don't want people to wait until February and say, oh, it's happening. It's been explicitly said in our working families, our students in the K-12 system, our higher education students, our home health aides, our workers are going to suffer a lot. And we're not even talking about the burden that it will put on existing workers and business and government and sectors if there is indeed the mass deportation that has been advertised for over a year. So think about if the federal government cuts Medicaid by 10%, what does that mean for Massachusetts? Is thousands of people that are going to not have resources and access to healthcare. So I'm going to leave it there because I think other people should, but it is, those are the numbers that I have now.
Thanks, Viviana, and thanks so much for just kind of like providing that picture and providing that context even of how much we as a state rely on funding from the federal government. That's incredibly helpful to just sort of like ground ourselves a little bit. I'm curious to go to Liz next. I know that Viviana even mentioned a couple of food benefits programs, Liz, and I don't know if you want to pick up there or have other things that you want to share, but would love if you could answer the question next.
Yeah, I'm happy to pick up from Viviana. The comment I made about us not being an island unto ourselves. I have been since 2018 in the Food Policy Council, and youth of both Gardening the Community and the Food Policy Council have been advocating for the Farm Bill. And the Farm Bill is this huge piece of federal legislation that gets passed every 5 years. The 2018 Farm Bill was passed. The 2023 Farm Bill was not passed because we engaged with local and national organizations from across the country for a transformational Farm Bill. We wanted to address everything from labor. Farm labor is still some of the most, maybe the most marginalized, actually, I should say food system labor is the most marginalized labor in our country. We have children working in meat packing plants, and it's not a coincidence. They are the children often of undocumented neighbors. And I say that intentionally because it all fits together. People who work on farms in our state, in the valley where I live, in the Connecticut River Valley, it is not the Pioneer Valley. We need to stop using that harmful language. The Connecticut River waters the crops and keeps us alive, and it's much more accurate. But we have folks working on farms making $8 and $10 an hour and receiving no breaks. and leaving the farm with no food because the farmer is fearful that they'll go sell the food. They don't even give them enough food to take home. This is really unjust in the state of Massachusetts, but the Farm Bill didn't pass because the House put forth a really wretched version. Many people believed we would have a Democratic administration, and we thought we'll get it fixed then. We certainly didn't expect to lose both houses of Congress. And Viviana says it really discreetly when she says it's not looking good. It is, in fact, looking pretty bad. An example is we like to tout that we have universal free meals. In the state of Massachusetts, we still have major urban centers falling under what's called community eligibility provision. That is a federal provision in the government that allows for reimbursement of student meals, which is why we as a Commonwealth could afford fairly easily to say, yes, we should feed all of our kids, because the Commonwealth didn't have to worry about feeding kids in places like Springfield and Holyoke, where we have universal CEP, and in other cities where we have a number of schools with that provision. And I asked the same question that Viviana had, is what's our state going to do? And it is about us educating the legislature and helping them to recognize there may have to be something different done with taxation. There may have to be something different done with an allocation, but I know that some of my friends in philanthropy are on here. And so I want to say to philanthropy, please think carefully about not just food programs, but all of the what the right likes to call entitlement programs. And I find that language abrasive, except for the fact that people are entitled to good, safe housing. They are entitled to communities where they can breathe, and they are entitled to have healthy food to eat. So we are anticipating, though, that much of our work on the federal level will be much more about resisting than advancing any new policies. And we are working to identify partners in deeply red states that have benefited from programs like the Local Food Purchasing Agreement. Many of you know it as the program that lots of nonprofits are working with farmers to bring free either community shares of agriculture or free markets to our neighborhoods. And we've been able to do that really effectively statewide. That money comes through MDAR on the ground, but it comes from the federal government. So I want to know every red community that has benefited from that. And I'm a very pragmatic person, because many of you have heard me say I've been Black a really long time. There's lots of ways to move what you want forward. And some bases are going to move policy in places where mine is not. So if my white partners in rural communities have benefited and their communities have benefited, I want them telling the story so that budget doesn't get cut. And we need to do that in every sector.
Thanks, Liz. I want to end this question with hearing from Shin-Yi and then Paula on the landscape of your work and how it potentially could shift with the incoming federal administration. So let's talk about that. And I do just want to note, I know we only have about 8 minutes or so left, and I do, after you all speak to this, want to hear from all of you on opportunities that you see and how you're planning on moving forward in your work. And I think some of this you all have already started to share in your responses so far, but we'll want to tie all of that together. So maybe we have Shin-Yi and then Paula.
Sure. I think as Viviana and Liz have already talked about, I think all of us in this space are grappling with this uncertainty about sort of what the shift in federal landscape is how that's going to affect us, right? There are going to be funding. We know there's going to be funding changes. We know there's going to be changes in regulation and different policy priorities. And that trickles down to the local level. So, for example, about 50% of DPH's budget, the State Department of Public Health's budget, comes from the federal government, from CDC, FDA, those types of agencies. And those of us at the local level are really concerned about what this means for local governmental public health programs. Some local health departments get grant funding directly from DPH, and that funds the vital services that they provide to the community. And that funding might look different with the new administration. Even for those health departments that don't get funding from DPH, we, as health departments in our, sort of therefore our residents rely on services that DPH provides. This is everything from communicable disease surveillance and the state public health laboratory that provides testing for everything from rabies to food samples to beaches so that we have clean water to swim in, to our food protection program, to substance use services and other services for vulnerable residents. I'm worried about what that's going to look like and how do we fill in those gaps and continue to serve all of our residents in the coming years. I think other services that could be impacted are things like the federally funded Vaccines for Children program, right? That program allows healthcare providers, including local health departments, to provide vaccines free of charge for all children. There's also things that people may not realize local health departments are involved in. So think about things like public health emergency preparedness efforts. We saw that how critical that is during the pandemic, and that's largely funded by the CDC. So we'll have to see sort of how these funding and policy changes affect our work, and how we can sort of lean into working with our community partners to continue to provide, not have a break in services.
Well, in terms of clean energy, the picture is not much better than what we have heard so far. So, as many of us are aware, the incoming administration has plans to boost fossil fuel production and reverse policies and regulations aimed at reducing heat trapping emissions. One of the slogans of the campaign was "Drill, baby, drill," which points to the administration plan to scale up oil and gas production. President-elect Trump has also said that he will end offshore wind on day one. This is unlikely to happen, but his administration could actually stop some development and make things harder for proposed and planned projects. And just for context, in Massachusetts, we have a requirement of procuring 5,600 megawatts of offshore wind over the next few years. And offshore wind is a technology that it's actually very important for several coastal communities and their decarbonization plans. And in addition, the administration is also planning to undo Inflation Reduction Act incentives, which provides massive subsidies and incentives to clean energy technologies. So the threat is real in terms of being able to build as many new clean energy projects in the scale and at the pace that we need. And it's also real in terms of moving, the threat is real in terms of being able to move away from fossil fuels, which are the main driver of heat trapping emissions and also of air pollution. So basically what we are looking at right now is we can make sure that we keep a state at state level. We know that state action has been important, but now is really crucial. So one of those things that is very important is to look at new funding sources for new investments for our climate and for our communities. We will need to go on offense in terms of policies, as the agenda that Alexis shared earlier. Policies that are necessary to making our earth breathable, driving down emissions, protecting and improving the health of our communities, and making sure that we transition away from fossil fuels as quickly and equitably as possible.
Thanks so much, Paula. And it's super helpful to just hear from you all, right? Like, what have some of the successes been? Because there have been some, but then what are the challenges that perhaps you all are anticipating? And then I think the last thing that it would be super helpful to land on, because, for the folks calling in, many of these people receive MPHA's newsletters where we like to blast opportunities for people to take action, and take action on some of the incredible work that you all are leading or that you're actively participating in. I'm curious to know, as we look forward, as we look into the new legislative session over the next couple of years, thinking about the federal, state, and or local landscape, can you just name, and maybe we could do this like a lightning round, perhaps one opportunity you see emerging, or one thing that you or your organization is sort of doing to leverage an opportunity or to address any of the challenges that you've shared. So why don't we actually do like kind of a snake format? So we ended on Paula, and then why don't we start off with Paula this time around, and then go to Shin-Yi.
Well, the first opportunity has to do in terms of the new legislative session that we are about to start, and making sure that our priorities are part of that discussion, including on public health, air monitoring, and so on. So connected to Alexis, the priorities that you mentioned at the beginning of this session, of this panel, and I'll stop there.
So Paula, essentially ensuring that legislators prioritize those issues and like making sure we kick off the start of the session with a bang, for lack of a better word.
Yes, and hopefully it doesn't take 2 years until the very last minute of the session for legislators to move quickly in terms of taking action as well. That's a pressure point that I hope that we all are able to make sure that our legislators listen, that an area of an opportunity for improvement.
Thanks, Paula. Why don't we get you next, Shin-Yi?
I think the thing that's on my mind the most is thinking about how we leverage partnerships, right? How do we work together, both between governmental and non-governmental organizations, community-based organizations, businesses, everybody, both strengthening existing relationships and building new ones. This is not the time to retreat to our silos and feel sorry for ourselves. This is the time to work together to get the work done.
Thanks, Shin-Yi. Why don't we get Liz next?
Yeah, ditto to Paula and to Shin-Yi, absolutely. And we have to pay attention to what's happening federally. Partnership. I think we have to grow more food. We have to really consider urban agriculture. Tariffs are going to just wreak horrible havoc on every community, but especially BIPOC and low wealth communities. And so we need to pass legislation and incentives so that we can grow more food and enable the more than 150 BIPOC farmers we have in our state who know when things are here to grow food, because they grow culturally relevant crops. I know Viviana would add to that.
Viviana, why don't you close?
So I'm going to close, and I am going to quote Jessica Tang, the president of the AFT for Massachusetts. So this is not my idea. So I'm going to steal it from her. So she said that if we are going to think about the next 4 years, we need to first protect and preserve the gains that we have had. So protect the fair share, protect the student, the SOA, the Student Opportunity Act. The environmental bill that was just passed. So let's protect and preserve. 2, let's prevent things from happening. And this is when the organizing and the advocacy, it's going to take place. So let's prevent from more tax cuts be given to the wealthiest. Let's prevent from a budget not to be one-sided. Let's prevent the state of Massachusetts from just preemptively comply with the federal government, because this is one of the concerns that we have in my peer organizations. Is like people are like, okay, it's coming. I'm just, I'm going to wait for the hit. No, let's not preemptively comply. So let's prevent from things to happen, including that our neighbors that are unauthorized are taking out of their homes. So I'm completely with you. And third, that's the third P, which is proactive progressivism. Let's just be progressive, move progressive policies, move a progressive budget proactively and not be reactive.
Thank you, Viviana.
One more thing, and the housing panel set us up talking about residents.
Yeah.
Like we have got to all engage more people, and we have to be engaged beyond our titles. Nobody gets to stand on the sidelines. If I can carry a box of food and give it out, that is important as speaking to a legislature. Put your feet to work and don't decide what you can't do and what your limitations are. Pick something outside of your space. If you need a break from your own work, go partner on energy, go partner on housing, but nobody gets to stand by.
Yes, I love it. I love it. Thank you all so much. This is truly wonderful. And again, I love seeing people from such different sectors come together, recognizing that all of this is so connected and so necessary. And we really do have to be supporting one another's work. One thing that I'll just say for folks that are in the audience, if you are hearing this panel conversation and you're like, oof, wow, I get really fired up about vaccine dissemination and making sure that local boards of health have what they need for that. Or you're listening to this and you're thinking, man, making sure that energy infrastructure is cited equitably is incredibly important. And that's really like stirring something up in you. If you're listening to this and you're like, whoa, what do we do about the state budget? And how do we make sure that our state it ends up filling in any potential gaps where there might be cuts in federal funding? Or if you're listening to this and you've never heard about universal school meals or HIP, or you have and you care a lot about them, please, one, take note of the names of these women who are on this panel right now and the organizations that they work with. And then also be sure to pay close attention to the MPHA newsletter, where we will in the new session be sharing opportunities for you to take action on all of these issues. So thank you again. If the audience can just put in the chat some love and some thanks. I see that we already have that going for our panelists. That would be wonderful. Thank you so much, Viviana, Paula, Liz, and Shin-Yi. It's been wonderful chatting with you all.